Ingrezza, valbenazine, is a medication used to treat tardive dyskinesia in adults. Tardive dyskinesia is a neurological disorder characterized by involuntary movements of the face, tongue, and limbs. Ingrezza is a selective vesicular monoamine transporter 2, VMAT2, inhibitor, which means that it works by regulating the amount of dopamine in the brain. Dopamine is a neurotransmitter that helps regulate movement and other cognitive functions. Ingrezza is believed to work by inhibiting the reuptake of dopamine into the vesicles of presynaptic neurons, leading to decreased dopamine release. By reducing the amount of dopamine in the brain, Ingrezza helps to reduce the involuntary movements associated with tardive dyskinesia. This mechanism of action is unique to Ingrezza and is different from other medications used to treat this condition. Ingrezza has been shown to be effective in clinical studies, with many patients experiencing a reduction in symptoms. However, it is important to note that not all patients may respond to Ingrezza, and it may take several weeks to see the full effects of the medication. Uses of Ingrezza in medical treatment. Ingrezza is primarily used for the treatment of tardive dyskinesia in adults. Tardive dyskinesia is a movement disorder that can occur as a side effect of long-term use of certain medications. It is characterized by involuntary movements of the face, tongue, and limbs and can be embarrassing and even debilitating for patients. Ingrezza is the first and only medication specifically approved by the U.S. Food and Drug Administration, FDA, for the treatment of tardive dyskinesia. It has been shown to be effective in reducing the symptoms of tardive dyskinesia in clinical trials. Ingrezza is taken orally once daily, with or without food. In addition to its use for tardive dyskinesia, Ingrezza has also been studied for the treatment of other neurological disorders, including Tourette syndrome and Huntington's disease. However, it is not currently approved for these uses. Common side effects of Ingrezza. Like all medications, Ingrezza can cause side effects. The most common side effects of Ingrezza include somnolence, sleepiness, dry mouth, and akathisia, a feeling of restlessness or agitation. These side effects are generally mild to moderate in severity and usually go away on their own over time. Less common but more serious side effects of Ingrezza can include QT prolongation, a heart rhythm disorder, neuroleptic malignant syndrome, a potentially life-threatening neurological disorder, and serotonin syndrome, a potentially life-threatening reaction to certain medications. These side effects are rare but can be serious, so it is important to be aware of them and seek medical attention if they occur. It is important to note that not all patients will experience side effects from Ingrezza. However, if you experience any unusual symptoms while taking Ingrezza, it is important to speak with your healthcare provider. Dosage guidelines for Ingrezza. The recommended starting dose for Ingrezza is 40 mg once daily. Your healthcare provider may adjust your dose based on your response to the medication and any side effects you experience. Ingrezza should be taken at the same time each day, with or without food. It is important to follow your healthcare provider's instructions for taking Ingrezza. Do not stop taking Ingrezza or change your dose without first speaking with your healthcare provider. Precautions and warnings for using Ingrezza. Ingrezza is a prescription medication and should only be taken under the direction of a healthcare provider. Before taking Ingrezza, it is important to inform your healthcare provider of any medical conditions you have, including heart problems, liver problems, and depression. Ingrezza can interact with other medications, including certain antidepressants and antipsychotics. It is important to inform your healthcare provider of all medications you are taking, including over-the-counter medications and supplements, before starting Ingrezza. Ingrezza may cause drowsiness or dizziness, so it is important to avoid driving or operating heavy machinery until you know how the medication affects you. Interactions with other medications. Ingrezza can interact with other medications, including certain antidepressants and antipsychotics. Ingrezza should not be taken with monoamine oxidase inhibitors, MAOIs, or within 14 days of stopping an MAOI. Ingrezza can also interact with certain medications that affect the heart rhythm, including certain antibiotics, antifungals, and antipsychotics. It is important to inform your healthcare provider of all medications you are taking before starting Ingrezza. If you experience any unusual symptoms while taking Ingrezza, it is important to speak with your healthcare provider. Alternative treatment options to Ingrezza. In addition to Ingrezza, there are other medications used to treat tardive dyskinesia, including tetrabenazine and deutetrabenazine. These medications work by regulating the amount of dopamine in the brain, similar to Ingrezza. There are also non-medication treatments for tardive dyskinesia, including deep brain stimulation and botulinum toxin injections. These treatments are generally reserved for patients with severe symptoms or those who do not respond to medication. Patient experiences and success stories with Ingrezza. Many patients with tardive dyskinesia have experienced significant improvement in their symptoms with Ingrezza. Some patients have reported dramatic improvements in their ability to perform daily activities and interact with others. It is important to note that not all patients will respond to Ingrezza, and individual results may vary. It may take several weeks to see the full effects of the medication, and some patients may experience side effects. Conclusion and final thoughts on Ingrezza. Ingrezza is a unique medication used to treat tardive dyskinesia in adults. Understanding its mechanism of action, uses, side effects, and dosage guidelines is crucial to making informed decisions about this medication. While Ingrezza can be beneficial, it is important to be aware of its potential side effects and interactions with other medications. It is important to follow your healthcare provider's instructions for taking Ingrezza and to speak with them if you experience any unusual symptoms while taking the medication. Ingrezza has been shown to be effective in reducing the symptoms of tardive dyskinesia in clinical studies, and many patients have reported significant improvement in their symptoms. However, not all patients will respond to Ingrezza, and individual results may vary. If you are considering Ingrezza as a treatment option, it is important to speak with your healthcare provider to determine if it is right for you. Thanks for watching.